This is one of the most dangerous health problems. 40,000 people dying of the disease. How did it manage to travel? Dengue infection can increase the risk of cancer. Mosquito traveled in these tires. Hi, good morning. Dengue fever is back with more than 390 million cases every year and around 40,000 people dying of the disease. This is one of the most dangerous health problems at this time of the year. But even more dangerous is a recent finding which has shown that dengue infection can increase the risk of cancer. Yes, you heard me right. But before we talk about the link between dengue and cancer, I would like to talk about the dengue fever by itself. So what exactly is dengue? Dengue fever is caused by a virus known as the dengue virus. This is an RNA virus, which means it's a very small sized virus with only RNA, no DNA in it, and it is spread by a mosquito. A particular type of mosquito known as the Aedes mosquito, that's Aedes. How to recognize this mosquito is quite easy. It has dark and light stripes on it, like a zebra, black and white stripes on it. And it is found in tropical and subtropical areas. But the mosquito is now found in most of the continents in the world. The Aedes mosquito, especially the Aedes aegypti mosquito, traveled all over the world from the tropical and subtropical regions. Now it can be found on almost every continent apart from Antarctica. But the question is, how did it manage to travel all across the globe, especially to the New World, the North and South America? And in South America, it has become quite endemic. And the answer is by tires. Yes, you heard me right. By car and truck tires. There's a big trade of used tires which have been transported from Asia and Africa to the American continent. And the mosquito traveled in these tires because whenever there is water collection, the mosquito can lay down its larvae, which can grow into full-blown mosquitoes. And the tires, old tires especially, are one of the best places for the water to be trapped, which becomes a very good breeding ground for the mosquito larvae. So the virus has traveled with the mosquitoes and it has spread all over the world. The virus spreads by the mosquito bite from one person to another. Once the virus enters into the body, it takes between 3 to 14 days, that is up to 2 weeks, for the infection to become symptomatic. The symptoms include fever, headaches, vomiting, a skin rash, muscle aches known as myalgias, and joint aches known as arthralgias. In a very small proportion of the patients, you will get severe dengue fever. And in this severe dengue fever, the platelet count drops. Now, platelets are very small particles found in the blood whose job is to block and stop any leakage from our blood vessels are always at risk of small punctures, and platelets plug in these small holes and stop the blood from leaking out. If the platelet count drops very low, then the small punctures in the blood vessels cannot be plugged effectively and blood and plasma starts to leak out. This causes internal bleeding all over the body in all the organs. And the result is low blood pressure and a situation of circulatory shock, and people can die of it. Fortunately, the human body has a very good defense system against all viruses and bacteria, including the dengue virus. And within 7 days, most of the patients would be automatically cured of this viral infection. A small percentage would require longer time, and they might need medication, fluids, blood transfusions or platelet transfusions, and hospitalization. but most of the cases make a very good recovery. Now, let's come to the diagnosis of dengue fever. Dengue is very similar to many other viral illnesses like yellow fever or chikungunya viral infection. It's also very similar to some parasitic infections like malaria. But as the body defense system makes antibodies against the dengue virus and its RNA, it is quite easy to check these antibodies, the specific chemicals made against the virus, and diagnose that the person has got dengue fever due to dengue virus rather than a fever due to another virus. There are two types of vaccines available to prevent dengue virus. The first one is known as the Dengue vaccine. This was approved in the European Union in 2018 and in the United States of America in 2019. The vaccine has got live but weakened, in other words, attenuated viruses, and it covers all four major types of dengue viruses. The vaccine is given as 3 shots, and then there's a booster at 6 months and 12 months. But here's the interesting part. The vaccine is not given to everyone. And if given to people who've never had a dengue virus infection before, once they get the infection, they can have severe reaction to the live virus. So the vaccine is only preserved for people who have already had dengue infection and are at risk of having it again. Now, this is a very interesting phenomenon. If you give the vaccine to people who have never seen dengue virus before, their immune system reacts very severely to it, and on exposure to the dengue virus infection, it causes a severe reaction in the body. So people who've never had dengue virus before are unsafe to receive this vaccine. And the vaccine can only be used to stop a reinfection in a person who has previously had the dengue virus. Another interesting thing about Dengue vaccine is that it cannot be given safely in people who have a low immune response. With other vaccines we've seen with the dead viruses, you want to give it to people who have got low immunity. But because this vaccine has got a live virus, although a very weak virus, there is risk that people with low immunity would get a serious dengue infection. So there are limitations to the use of this vaccine. It cannot be offered to everyone. And the basic method of protection is prevention from the mosquitoes. Now, the question which comes to everyone's mind is, what are the side effects of the dengue vaccine? Starting with the dengue vaccine, as it has got a live set of viruses who are very weakened, it will cause a mild dengue-like infection. So there would be headaches, there would be muscle aches, myalgias, there might be joint aches, arthralgias, and the person would feel a lot of pain on the injection site. But all of these symptoms settle down with time. Very rarely people could have allergic or even severe allergic, what we call the anaphylactic reaction, but this is extremely rare. Because of the limitation of the dengue vaccine, a new vaccine is being developed, which is almost ready to come into the market, known as the TAC-003. This is a recombinant technology vaccine and does not use live viruses. It uses all 4 types of dengue viruses, especially the type 1, 3, and 4. They're components from 1, 3, and 4 viruses which are attached to a backbone of type 2 virus. So it gives a comprehensive cover against the 4 major types of dengue viruses. And now we move to the most important part of our discussion, the link between dengue infection and cancer. And this is a very new finding. A study done in Taiwan, which involved more than 12,000 patients, has shown that after 3 to 6 years of having dengue viral infection, the risk of leukemia, a type of blood cancer, can go very high. The question arises, why is it so? And the answer is that most probably because the body's defense system, which consists of white blood cells, is fighting the dengue virus and producing new cells at a very fast rate. Some of those cells could have defective DNA. It is also possible that the viral infection could cause damage to the DNA and lead to mutations, which can result in cancer for the white cells, and hence the blood cancer, leukemia risk goes high in 3 to 6 years' time. The next thing which comes to our mind is how high is that risk? And the estimate by the scientists in Taiwan is that the risk is almost 2 times higher than the normal population risk. So if a person or a population is at risk of having leukemia 2%, this would double to 4% in people who have had dengue viral infection. And if it's a 4% risk, it will double to 8%. So whatever the current risk of having leukemia is in a population or a person, after dengue infection in 3 to 6 years' time, that risk becomes double. This once again brings to us the importance of preventing dengue infection, because dengue infection is not only an immediate threat, but in the long term, especially 3 to 6 years after the infection, it is increasing the risk of a blood cancer known as leukemia. This is a fairly new development and has not been covered much in the media. Killing Cancer Kindly is bringing you this update and many other updates about cancer and its risk and how to decrease this risk and avoid the disease altogether. So stay tuned for more information on promoting health, preventing disease, staying younger, and living longer by Killing Cancer Kindly. Thank you very much for your time.